Hi guys, welcome to Structure and Function, and in this episode I'll be talking about leukocytes. So the learning objectives are to be able to know and draw the different types of leukocytes, to be able to recall the normal abundance of each of the different types of leukocytes, to know the basic functions of each type of leukocyte, and to know the process of the Giemsa stain. So to start off with, we're just going to talk about the Giemsa stain. So the Giemsa stain is a mixture of different coloured compounds which, when absorbed into white blood cells, can help differentiate them. These include an acidic eosin dye, which is red, got the methylene blue, and azole B, which is purple. So this is the process that you use to do the Giemsa stain. So to start off with, you need to make a blood smear. So first of all, you place a drop of blood near one end of a clean glass slide. So if you look at this picture down here, we can see the blood drop here. What you then need to do, you then draw a spreader back towards it. So you place a spreader here and then you draw it backwards at an angle of about 25 to 30 degrees, and then allowing the blood to spread, as you can see here. Once you've done that, you then push in a smooth motion across the slide, so you eventually end up with like a thumbprint shaped smear. Then once you've got that, you then need to start staining it. So you then need to fix the film in absolute methanol, or for a more safer alternative you can use 70% ethanol, for 10 to 20 minutes, but if methanol is used, obviously you have to reduce the time dramatically to about 30 seconds. Then you stain with the buffered Giemsa stain, which is a concentration of 5 to 10%, for about 30 minutes. You then rinse using the Giemsa phosphate buffer for 2 minutes. You drain it and then allow it to air dry. You can then fix the cover slip and enjoy looking down the microscope. So all this time I've been saying about a leukocyte, but what is it? Well, basically it's the posh name for a white blood cell. And as we all know, white blood cells are involved in immunity and protection, and each type, there's actually 5 different types, they all play a significant role in the protection from pathogens and harmful material. So here's a mnemonic just to help you remember them. So the 5 types of leukocytes are called neutrophils, lymphocytes, monocytes, eosinophils, and basophils. So the best way to remember it is never let monkeys eat bananas. So we can start off talking about neutrophils. So this here is just what you see if you use the Giemsa stain on a blood smear. So this here is a neutrophil. So as you can see, it's got multiple lobes and its size in relative comparison to a red blood cell. So a few basic stats and figures. So approximately 60% of all your white blood cells are neutrophils, but sources vary, but the 6% is what's most agreed upon. And they tend to be around 12 to 15 micrometers. They have about 2 to 5 different lobes, all joined together by thin chromatin strands. They are granular, so they've got granules within them, and they circulate around the blood for about 8 to 10 hours before migrating into the tissues. And the function of the neutrophil is phagocytosis. So the cytoplasmic granules release a concoction of enzymes which include lysozymes, proteases, oxidants, and antimicrobial defensive proteins. If you detect an increase in neutrophils, that's usually a result of an acute infection, stress, eclampsia, gout, myelocytic leukemia, rheumatoid arthritis, rheumatic fever, thyroiditis, or trauma. If you get a decrease in neutrophils, that's usually a result of aplastic anemia, chemotherapy, influenza, radiation, viral infections, or widespread severe bacterial infections. Now we're going to talk about lymphocytes. So this here is a picture of, again, you've got the blood smear, and this here is the lymphocyte. So as you can see, it's just one large nucleus with really little cytoplasm. So this is agranular, and it's approximately 1/3 of your total white blood cell count. And it's pretty small, it's only 10 to 12 micrometers. As I said, it's also a single large nucleus. This can then be further broken down into 3 different categories. You've got B lymphocytes, which take up about 10 to 30% of all your lymphocytes. They're involved in humoral immunity, so these are the ones that, when they become plasma cells, they release antibodies. Then we've got the T lymphocytes, which take up between 40 to 80%. And these are involved in cell-mediated immunity, and these can then be further categorized into 4 types. You've got T helper cells, cytotoxic T cells, memory T cells, and suppressor T cells. And then also you've got the natural killer cells, which are involved in fighting cancer and viral infections. And what these do, these are non-specific killing and are indiscriminate. So if they see something that's harmful, they will just attack it without having to do further recognition. If you detect an increase in your lymphocyte counts, it's usually a result of a chronic bacterial infection, hepatitis, mononucleosis, lymphocytic leukemia, multiple myeloma, or viral infections. And if you detect a decrease, that's usually a result of chemotherapy, HIV, leukemia, radiation, sepsis, and steroids. Now we're going to move on to monocytes. So monocytes are only about 5% of your total white blood cell count, and these are pretty big, as in they are 16 to 22 micrometers in diameter. And as we saw in the previous slide, they've got like a kidney-shaped nucleus, and they're also precursors for macrophages. So their main functions is to undergo phagocytosis. So they go around and phagocytize all foreign materials such as bacterial cells, viruses, or even foreign material that shouldn't even be in the blood. An increase in monocyte count is usually a result of a chronic inflammatory disease, leukemia, parasitic infections, TB, and viral infections. And a decrease is usually as a result of HIV, rheumatoid arthritis, lupus, vitamin B12 deficiency, and chemotherapy. Now we're going to move on to eosinophils. So they take about 3% of your total white blood cell count, and they can either be bi or trilobed, so either 2 or 3 lobed nucleus. They circulate for about 6 hours before entering the tissues, and they're relatively big, between 12 and 17 micrometers. And as we can see, they are very, very granular. So all these little circles that you see, those are the granules. And the functions of eosinophils, well, the granules are similar to a neutrophil, but also include histaminase. So this is an antihistamine. It's capable of damaging parasitic membranes with cationic proteins and peroxidases, and it's specialized for extracellular killing. So it's too small to do phagocytosis, but it can release this concoction of enzymes and chemicals to destroy the parasite from the outside. So an increase in eosinophil counts is usually a result of parasitic infection, allergies, Addison's disease, cancer, collagen vascular disease, or hypereosinophilic syndromes. And a decrease is usually a result of alcohol intoxication and steroids. Then we're going to move on to basophils. So these are less than 1% of your total white blood cells count, and they're very, very small. They're only 8 to 10 micrometers in diameter. They have an irregular bilobe nucleus, and they are very, very granular. So the function of the basophil is it's basically involved in inflammatory and allergic reactions. An increase in your basophil count is usually a result of a post-splenectomy, allergic reaction, collagen vascular disease, myeloproliferative disease, or chickenpox. And a decrease in basophils will usually result from an acute infection or cancer or a severe injury. And that's it. That's all the basics about the leukocytes. So now we come to the test cell section. So here I'm going to allocate you a certain amount of marks per question. I'm not going to tell you how to get the marks. It's up to you to decide how to get the marks, create a mark scheme, and answer the question yourselves. So for 25 marks, draw a labeled diagram of each type of white blood cell and state the colours that it will appear when stained using a Romanowski stain, or Giemsa stain, depending on how you pronounce it. For 10 marks, a patient has had blood tests to see whether they are showing any signs and symptoms of cancer. Outline a staining process which can be used and what results should show if they turn out negative. And then for 2 marks, what results would you expect to see if the patient was tested positive for cancer? So that's it, guys. I hope you enjoyed, and good luck revising for your exams. Peace out.